Good morning, this is Dave Dyer with Biz Radio. It is Wednesday, March 11th, and I've got a couple of comments on this crisis supposedly that's going on in healthcare that requires us to change the entire way that we do healthcare in this country. And the crisis involves these 45 million poor people who don't have any health insurance. Well, now, think about it. All right, 45 million. Now, are those 45 million people who have gone an entire year without health insurance? Oh, I don't think so. First of all, they're probably counting you as being without health insurance if you had 1 day without health insurance, which a lot of people might have when they change jobs if they don't sign up for COBRA. So that ought to knock the number down. But I'll give them credit. There might be, at any one given time, 45 million people here who don't have health insurance. Although that number will change because some of them will get it when they get another job or go with COBRA. Number two, who are these people? All right, well, they can't be the elderly, because if you're over 65, you're covered. We got Medicare. Okay, so these 45 million people are not over 65. Number two, they can't be really poor people, because if you're really poor, you're covered by Medicaid. Medicaid is a program that it's administered by the states but funded by the feds. And there are tests. There's a means test that's based on income and assets, and it changes from state to state. But the truly poor people are covered by Medicaid. So, all right, the 45 million can't be the older folks, and they can't be the truly poor people. So who are they? Well, think about it. You think there are any illegal aliens in there? I bet it's about half illegal aliens. Half of the people that have no insurance coverage are probably illegal aliens. And the other half, it's people in transition. In some cases, it's people who live, outside the bounds of society. Maybe criminals on the run, people with mental problems that just can't get it together to deal with the world. But I'll tell you, I bet a bunch of them are illegal aliens. So that's why we're supposed to change our entire healthcare system to provide better healthcare for the illegal aliens. It's nuts. Now, here's the other thing to think about with this 45 million number. They say that's 45 million without insurance. And that may be true. There probably are 45 million people in this country, not citizens, people who don't have health insurance. That's not the same thing as having 45 million people who don't get health care. Because as anybody knows, you get free health care in this country by going to the emergency room. You go to any emergency room in Houston, and it is jam-packed with the illegals who use that as their primary health care system. That's the way it works. So not having insurance is not the same thing as not getting health care. Actually, everybody already gets free health care. The only thing that we may want to discuss is how we give them the free health care, because it's not very effective to have people show up at the emergency room and clog it up. But that is the subtle deception in this whole argument. Not having insurance is not the same thing as not having health care, because it's illegal for them to turn you away at the emergency room. So anyway, maybe it makes sense to argue about how we could change the rules for Medicaid, maybe tweak it a little bit. I mean, that's a different discussion. That's the social safety net that we have in this country to make sure that nobody, dies of lack of health care from, being in an auto wreck or having a broken arm or any of the things that happen to people. And we've got that social safety net. And if you're truly poor, you're covered by Medicaid. Maybe they need to tweak it. And maybe, you want to talk about tweaking Medicare a little bit. Maybe 65 is not the right age. Maybe you want to make it a little younger. Maybe you want to make it available voluntarily to people who retire earlier. All of those are reasonable discussions. We've already got 2 government-run healthcare programs, Medicare and Medicaid. When I point that out to liberals, they say, oh, well, they're no good. Well, look, if we got 2 that aren't any good, why would we want to start a 3rd one that covers everybody? You tweak, fix up, reorganize the ones you have. But don't mess up the world's best healthcare system. All right, anyway, this is Dave Dyer with Biz Radio. As always, go to bizradio.com, B-I-Z radio, and check out all the other good stuff on our website. Thanks. Bye-bye.